So today, we're going to dive into a book that's become a serious game changer for doctors working in the most critical situations you can imagine. It's called 50 Studies Every Intensivist Should Know, and it's all about one thing: taking complex medical research and turning it into life-saving action right now. Let's get into it.
Okay, so when you pick up a medical textbook, the last thing you expect is a comparison to, well, that novel, right? But that's exactly what a reviewer said. And you have to admit, it's a brilliant way to grab your attention. It just makes you wonder, what on earth is this book about? And here it is. Let's be clear, despite the catchy comparison, this is a seriously important tool. The only drama in these pages is in the data. And trust me, in the ICU, that data is about as high stakes as it gets.
So, you're probably asking yourself, how does a book filled with 50 dense medical studies become a must-read bestseller? What's the secret sauce here? Let's break it down.
Well, first off, you just have to look at the credentials. We're talking Oxford University Press. And the editor, Dr. Edward Bittner, he runs the Critical Care Fellowship at Massachusetts General Hospital. So right out of the gate, you know this thing has some serious weight behind it.
And this book tackles a huge problem for modern doctors. I mean, think about it. For any physician, but especially for an intensivist in the ICU, new research is coming out constantly. It's like trying to drink from a fire hose. How in the world do you find the stuff that actually matters, the signal in all that noise?
You see, in the ICU, everything can change in a heartbeat. Decisions have to be made like right now, and they absolutely have to be the right ones. This isn't just about academic curiosity. It's about having the most current, proven knowledge on hand when a patient's life is literally on the line.
And this is all built on a huge idea, a real cornerstone of modern medicine, evidence-based medicine. It's the simple but powerful principle that you make decisions based on the best science you have, not just on how we've always done it. And you can think of this book as the ultimate toolkit for putting that idea into practice.
So here's what really makes this book a game changer. It's not just a greatest hits album of medical studies. No, its real genius is in how it's put together. It's designed to help doctors not just read the research, but to really understand it, criticize it, and apply it.
And check this out. This is the blueprint for every single study in the book. It starts with the question, goes into the results, but then, and this is key, it forces you to look at the criticisms and limitations. It puts the study in context with other trials. And then it wraps it all up with a real-world case scenario. It's teaching doctors to think like researchers, right there at the bedside.
All right, you want to see what's inside? Let's pull back the curtain on a few of these practice-changing and honestly sometimes mind-blowing findings.
Okay, this one is huge. For years, the conventional wisdom was to aggressively control the blood sugar of critically ill patients. It sounds logical, right? But then the NICE sugar trial came along and found that this approach was actually increasing the risk of death. Wow. Talk about a wake-up call that proves sometimes less really is more.
Here's another one that might surprise you. When someone has a cardiac arrest outside of a hospital, it turns out that compression-only CPR can actually be more effective in certain situations. It makes it simpler for a bystander to help, and it can improve survival. It's a small change that can make a huge difference when every second is critical.
And I love this next one because it proves that life-saving medicine doesn't always have to be about fancy machines and expensive drugs. A landmark study showed that for patients with severe respiratory failure, or ARDS, a simple physical act, turning them onto their stomach, could dramatically improve their chances of survival. It's low-tech, low-cost, and high-impact.
And sometimes, a single number can change everything. Before the trick trial, doctors would often give blood transfusions much earlier. But this study showed that, for most patients, it was safe to wait until their hemoglobin level dropped to 7.0. This one number completely rewrote the playbook, saving resources and reducing risks for countless patients.
And the list just goes on and on. The book tackles huge debates, like using hypothermia after cardiac arrest, giving patients sedation vacations to get them off ventilators faster, managing fluids and lung injury. Basically, it hits on all the biggest questions that keep intensivists up at night.
All right, so let's wrap this up. What's the bottom line on 50 studies every intensivist should know?
I mean, you can't get much clearer than this quote from the review. From junior postgraduate residents to senior consultants. That's huge. It's saying this isn't just for the rookies or the seasoned veterans. It's essential for everyone working in critical care.
And that really is the heart of it all, isn't it? This isn't just ink on paper. It's a bridge. It's a tool that takes decades of dense, complicated research from the lab and puts it directly into the hands of doctors to make better decisions and save lives.
So it kind of makes you think, doesn't it? This model of creating a greatest hits playbook for a complex profession is so powerful. So my question to you is, what other field out there desperately needs its own 50 studies guide?